everybody, today we will learn about anemia. But before knowing anything about anemia, we should know how does oxygen stays in the blood. So when oxygen enters into the blood, it binds to the hemoglobin which is present in the RBCs. This blood is now known as oxygenated blood. It flows in the blood vessels and reaches various organs where oxygen moves out and the carbon dioxide moves in. Now this blood is known as deoxygenated blood, and this reaches to the lung where further exchange of the air occurs and carbon dioxide moves out of the body and oxygen moves in. Now that we have made the understanding that oxygen binds to the hemoglobin, therefore for proper supply of oxygen to our body, sufficient amount of hemoglobin and sufficient number of RBCs and is required, plus they should be structurally normal, they should be anatomically normal. It's not just that they are present in a particular number, they should be normal as well. So what is anemia? Anemia is basically shortage of oxygen carrying capacity of the blood. There are multiple reasons of anemia, which is decrease in hemoglobin or RBCs number or concentration, production of abnormal RBCs, and loss of RBCs. Most common cause of anemia is iron deficiency anemia. Let's learn what is hemoglobin. When we separate the hemoglobin, it means heme means iron and globin means protein. That means proper amount of iron and protein in the diet is needed for production of hemoglobin. Vitamin B12 and folic acid, they are required for appropriate maturation of RBCs. So these key factors, which can be easily supplied by good diet, are very important reasons for anemia if not taken in sufficient amount. Other reason for production of decrease in RBCs is kidney disease. Kidney plays a very important role. Kidney produces a hormone known as erythropoietin, which stimulates the RBCs production in the bone marrow of bone. Other reasons are chronic infection and medication. These medications, they suppress the bone marrow, therefore suppress the production of RBCs in the bone marrow. Now, another common cause of anemia is production of abnormal RBCs. There are certain diseases that leads to production of structurally abnormal RBCs like thalassemia, sickle cell anemia. They lead to structurally abnormal hemoglobin or structurally abnormal RBCs. So the count is normal, the count is okay, the count might be decreased as well, but they lack the oxygen binding capacity. Another reason is loss of RBCs, which can be due to blood loss. Blood loss can be following surgery, following trauma, heavy menstrual bleeding. There can be multiple reasons. So when the blood is lost, then definitely RBCs, they also become less in the body. And another reason of loss of RBCs is destruction of RBCs. So all these factors leads to the anemia. And we should also know that the oxygen should be present in sufficient concentration in the air, because we must have heard, we must have seen, we must have experienced as well. Some of you might have experienced as well that when we go to the high altitude, like we go to Ladakh, we go to high hills, there the oxygen concentration is low and therefore we start feeling dyspneic, we start having difficulty in breathing. So oxygen concentration in the air that we are inhaling should also be appropriate concentration, which is 21% in the air.